Hi, I'm Dr. Jordan Weiner with Valley ENT. In this video, I'm going to discuss Inspire therapy for the treatment of obstructive sleep apnea. In this video, I'll discuss what Inspire therapy is, how it's done, as well as the recovery period, who is a candidate for Inspire therapy, as well as the risks of the procedure. Finally, I'll discuss insurance coverage. Inspire therapy is an implanted system that works during sleep by stimulating the tongue to move forward when you take a breath. It's turned on at night with a remote control and turned off in the morning. There are three parts to the Inspire system. There's an impulse generator, which is placed in the upper chest. There's a stimulating electrode placed on the nerve to the tongue just below the right side of the jaw, and there's a pressure sensor placed between two ribs to detect when a breath is taken. When a breath is detected, an electrical impulse is sent to the nerve, causing the tongue to move forward. This prevents the throat from collapsing. This is an endoscopy from a real patient with sleep apnea. You can see the complete closure of the airway resulting in apnea. Now with Inspire, you can see the opening of the airway each time the Inspire device is active. This prevents the apnea from occurring. Inspire is powered by a battery. The battery life is estimated to be about 10 to 12 years. After that, a replacement will be necessary. The replacement procedure will be a very minor procedure since the stimulating electrode and the pressure sensor will not be replaced. Inspire therapy requires a surgical procedure taking about 90 minutes. There are currently 2 incisions required. The first incision is just below the right side of the jaw, and the second incision is just below the collarbone or clavicle. The procedure is performed on an outpatient basis and results in fairly minimal postoperative pain. Typically, narcotic pain medicine is not required. Following the procedure, light activity for 2 weeks is recommended. Now I'm going to discuss who Inspire therapy is for. This is for patients with moderate to severe obstructive sleep apnea with an AHI representing the number of obstructions per hour of sleep between 15 and 65. They must have a body mass index below 35 and below 32 for certain insurance plans. Inspire is for adults over the age of 22. One of the most important concepts is that Inspire is for patients who are intolerant of CPAP. This means that despite appropriate efforts, they are not able to successfully and consistently use CPAP. A sleep study must be performed within 2 years of the surgical procedure. There cannot be a significant percentage of central sleep apnea, and during a sleep endoscopy, which will be discussed shortly, we cannot see complete concentric collapse of the airway at the level of the soft palate. Prior to proceeding with Inspire therapy, we need to perform something called Drug-induced sleep endoscopy, or DISE for short. This is a required step by the FDA and is performed in an outpatient surgery center. Intravenous sedation is given until the patient falls asleep and begins to snore and exhibit obstructive sleep apnea. At this point, a flexible scope is passed through the nose into the throat to visualize the airway at multiple levels. We're looking to make sure that the walls of the throat don't collapse in from the sides, since this pattern of collapse is much less responsive to Inspire. About 10 to 20% of patients will have this pattern of collapse, which we refer to as complete concentric collapse, and are not candidates for Inspire. Other surgical procedures, such as uvulopalatopharyngoplasty and tonsillectomy, may be appropriate at that point. Let's talk about the results of Inspire therapy. In published studies, the success rate is about 80%. My own success rate is also very high, with about 80% of patients having a final AHI below 10. In my patients, the average pre-op AHI is 34, and the average post-op AHI is 6. 5 years after surgery, over 90% of patients are still using Inspire every night, all night, and would recommend it to others. Like all surgical procedures, there are potential risks and complications of Inspire therapy. Tongue discomfort related to tongue movement at night is seen in about 8 to 12% of patients and usually resolves over time. Other rare complications include temporary weakness of the tongue, a temporary air leak into the chest during insertion of the pressure sensor, bleeding or infection after surgery, or problems with the internal wires or electrodes. Inspire is covered by insurance. The procedure is covered by Medicare, Blue Cross Blue Shield of Arizona, Aetna, and United Healthcare, all of which have positive coverage policies. Other payers will still often cover Inspire on a case-by-case basis. During the first month after surgery, Inspire is off. The system is activated at a follow-up visit with the sleep medicine provider approximately 4 weeks after surgery. At this visit, the device is turned on and programming takes place. The patient is sent home with a remote control programmed to have 10 selectable levels from 1 to 10. Patients begin using Inspire at level 1. After a few nights, if the therapy is not disturbing sleep, the patient increases the level to 2. This process is repeated until level 10, or at least the patient has gotten into the upper levels. At that point, a sleep study will be performed with additional adjustments to the device. Patients and their partners will often begin to see snoring and sleep apnea disappearing during this process. After the patient has successfully been able to use Inspire at level 10, or at least within the upper levels, they return to the sleep lab for a titration study using Inspire. At this point, the Inspire device settings will be adjusted to fine-tune the delivery of stimulation to the tongue. The patient will then be discharged with these new settings. A full night sleep study, often performed at home, should be performed in about 6 months to verify that the treatment is working well. Additional programming can be performed at that time if needed. If you think Inspire therapy may be the right answer for you, you can call my office to schedule a consultation to find out if you may be a candidate and learn more about this therapy. You can also schedule an appointment directly through this website.